Onlay augmentation is a special technique used to build up bone, in which the alveolar ridge is raised. The animation shows how bone recession sets in due to a lack of chewing pressure. Our body is very efficient. Use it or lose it. After a while, there is not enough bone matter left for an implant. The implant would stick out, as shown by the blinking light. Onlay surgery is used to replace the missing bone. A chunk of bone, either from a donor or from the patient's body, for example the chin, is screwed into place, evening out the difference in height to the rest of the alveolar ridge. After a few weeks, the transplant heals and an implant can be done. The sinus lift operation is an example of inlay surgery, the exact opposite because in this case the replacement bone is inserted between the patient's own bone and the mucous membrane in the jaw. The level of the alveolar ridge stays the same. This is the main difference between inlay and onlay surgery. In inlay surgery, the level of the alveolar ridge remains the same. In onlay surgery, it changes. If there are enough teeth remaining and only some bone and a few teeth missing in the back, then onlay surgery is better because it makes for a more pleasing appearance. If there are no teeth left and the alveolar bones have receded evenly, then inlay surgery, meaning sinus lift, is better. Sometimes the two techniques are combined. Nowadays, there are many surgical techniques which can be used to build up jawbone, using either human bone or bone from other animals such as cattle or synthetic bone material. Human bone heals best, while synthetic materials heal worst. With respect to human bone, it is possible to use either purified donor bones or the patient's own by transplantation. If bone is taken from the patient's own body, the chunk of bone should not exceed a certain size, because otherwise it would recede. This is because the transplanted chunk of bone contains various types of cells. The moment that the chunk is removed, the cells it contains are cut off from the supply of nutrients. If a chunk is small enough, then soon after transplantation it is once again connected to the supply of nutrients by the process of diffusion. If the bone is too big, then the innermost cells cannot be reached by diffusion, and it takes days for new blood vessels to grow into the bone. The cells inside the block are left without nutrients for too long, and they die. The immune system reacts by removing the dead cells, which causes the bone to recede. This is why larger bone chunks are transplanted on the microvascular level, along with the vessels which are then connected to other vessels in the area. This ensures the supply of nutrients to the transplant. Microvascular transplantation is usually not necessary. Smaller chunks of bone are enough. Nowadays, there are expensive techniques for growing bone, both synthetic and natural, in laboratories using a patient's own cells. This is supposed to speed up the transplantation process, but once the bone is removed from the optimum conditions of this incubator and transplanted into the patient, after a while the bone starts melting away due to a lack of nutrients. This method is interesting and sounds very nice, but it is expensive and ineffective.